episode of the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. On today's episode, we will be discussing the article entitled Pediatric Uveitis, the Uniqueness in Clinical Presentation and the Efficacy of Biologics Treatment, published in the Journal of Ophthalmic Inflammation and Infection in 2024. I'm Dr. Kelsy Steele, your host and the topical editor of the Anterior Segment Disease Care section. I'm thrilled to be joined today by our topical expert for this episode, Dr. A.J. Peiffer. Dr. Peiffer is a pediatric optometrist in the Division of Pediatric Ophthalmology and Adult Strabismus at University Hospitals Rainbow Babies and Children's and University Hospitals Cleveland Medical Center. He's also an assistant professor at the Case Western Reserve University School of Medicine, director of the Pediatric Optometry Residency at UH Rainbow, and a fellow of our academy. And as a personal note, my classmate. Thank you for being here today, Dr. Peiffer.
Thank you, Dr. Steele. I appreciate the invite.
Of course. So, big picture to get started, what was the overall purpose of this study? What were the authors interested in looking at?
Yeah, so the authors sought to evaluate the clinical characteristics of pediatric patients suffering from uveitis in their specific tertiary care clinic in Hong Kong. They aim to evaluate the treatment outcomes in uveitis with special attention to the role and efficacy of biologics.
Okay. And I know it's a big loaded question, but what did they find? I know they looked at a lot of different things. What were your main takeaways?
Yeah, this was a pretty involved study with a lot of things to report on. So I'll do my best to try to summarize a lot of the key points. The authors did a retrospective review of their cohort of children between the ages of 4 and 18 years old who suffer from uveitis and sought care between the start of 2022 and the end of 2023. They analyzed the demographics, uveitic characteristics, systemic status, treatment, and outcomes for 67 eyes and 37 patients. There was a slight female predilection in the patient population with a mean age of 11 years old. The vast majority were suffering from chronic uveitis that affected various portions of the eye. Based on the sun grading criteria, the majority of patients were classified as having anterior intermediate uveitis, with a notable amount of panuveitis in their cohort as well. Following systemic evaluation, the significant majority of cases in this cohort were determined to have an idiopathic cause or no general systemic cause of their pediatric uveitis. The systemic rheumatological conditions most linked to uveitis in this cohort were Behçet's, Tinea, and HLA-B27 associated, and comprised of less than 10% of in each case.
Okay.
JAA was found associated in really only 2 of the 37 cases.
Okay. Interesting.
They did report on a significant number of complications associated with the condition and the treatment, including posterior synechia, cataracts, glaucoma. Those were the most common in this study, along with fewer cases of band keratopathy and macular edema. The majority required treatment with systemic steroids to achieve control of inflammation. Fewer patients, though, were successfully controlled with systemic steroids alone. The majority needing oral steroids and also required the addition of a first-line steroid-sparing agent like methotrexate, mycophenolate mofetil, and a few finding success with cyclosporin A, azathioprine, or tacrolimus. Some were able to achieve control with one of these steroid-sparing agents alone, or with a minimal oral steroid use. 11 of the cases required biologics like adalimumab, infliximab, or tocilizumab for control. Yes, those are. In 12 of the 37 cases, they were able to discontinue all medications as a result of disease control. So that's a good number of patients that found remission.
So this study took place in China, and the authors did comment on how their results compared to some previous work that's looked at pediatric uveitis. So what were some of the commonalities that they discussed, and what were about some of the differences?
Sure. They summarized in a really nice table in their publication to kind of make it pretty clear and concise, the similarities and differences. So similar to the other reported studies, the majority of cases of pediatric uveitis across Asian and Western countries is still idiopathic, meaning there's not really much of a systemic association. There's also a similar proportion of cases aligning with gender predilection, age of onset, anatomical locations affected, and laterality of the disease. Across all of these studies, including the current, chronic anterior uveitis is reported the most. Where this study differs related to the other studies is in the non-idiopathic associated uveitis. This study highlighted the variety of ethnic and geographical distribution of cases of pediatric uveitis. So in Southeast Asian cohorts, they had equal prevalence of Behçet's, Tinea, and HLA-B27 associated uveitis, and that was at least as common or even more common than juvenile idiopathic arthritis. In North American and European Caucasians, JIA is actually the one reported to be the most common cause of pediatric uveitis.
Yeah, I feel like Behçet's is normally a little bit lower on that list in that cohort. But okay, so you touched a little bit on, all the different kinds of treatments that they require to keep these conditions under control for the kids. So what are some of the treatment options for pediatric uveitis? And does it differ or does it not differ for the general treatment that we use when we're treating adults with uveitis?
Of course, it's a lot to consider. And just like anything in the pediatric population, there's potentially some more considerations. But treating the uveitis involves a combination of therapies directed at both the ocular manifestations and the underlying systemic cause, if there is one.
Right.
Topical corticosteroids are the mainstay of treatment to quickly subdue the uveitis. However, this is often insignificant and not enough as a standalone treatment. A combination of topical and oral corticosteroids may also be insufficient, as highlighted in this study, and long-term use may result in undesirable side effects. Steroid-sparing agents and biologics play an important role in achieving disease remission. These agents, though, need to be carefully dosed, monitored, and modified in pediatric patients as they grow and develop, and as they achieve disease remission, or unfortunately, there are reported cases of drug resistance that can occur, especially with Humira. Highlighted by the authors in this study were the efficacy of methotrexate and Humira, or adalimumab, with notable alternatives with mycophenolate mofetil and tocilizumab, or Actemra. The management is really quite similar to adults. However, the complications, evaluation of pediatric patients, and the surgical considerations may differ from that in the adults.
So we talked a little bit about some of the complications that they reported in this study, but what are some of the potential complications associated with pediatric uveitis, both related to the disease itself and then related to its treatment? We know that, steroids, both topical and systemic, can lead to a lot of complications.
Yeah, unfortunately, just like you said, it's both the condition and the treatments have associated side effects, and they can be significant. As reported by this study and others that highlighted the comparisons, cataracts, posterior synechia, glaucoma, band keratopathy, and macular edema were among the most common across all studies. This particular study reported on theirs being the most common as posterior synechia and cataracts. And up to a third of pediatric uveitis cases result in severely reduced vision as a result of these complications. Elevated eye pressure and cataracts can form as a result of both the condition and the treatment with topical steroids and oral steroids. And macular edema can occur and may also present as a result of the intermediate uveitis. Thankfully, in intermediate uveitis in pediatric patients, as they highlight in this study, is actually less common than it is in adults.
So in closing, should we as eye care professionals implement any changes in our care of patients based off the findings of this study?
I think these studies always bring back to light the importance of the role that eye care professionals play in conditions like this. And I think the findings in the study highlight the challenges and the importance of evaluating and managing pediatric uveitis aggressively, as well as the necessity to closely monitor and prolong treatment to avoid relapses. Draws particular attention to the variety of undifferentiated and systemic associated uveitis across ethnic and geographical differences. It's important to note as practitioners, especially in the setting like I am, that there's a pretty diverse population from individuals that travel from various parts of the world. So we need to keep that in consideration when we're treating the patient, that we're not just referencing studies based on our country or our demographic of patients as the practitioner, but considering the broad range of ethnicities, backgrounds, and travel history that may actually then guide our management and treatment for the systemically associated uveitis.
Yeah, excellent point. Well, thank you so much for your insights today, Dr. Peiffer. And thank you for listening or watching. We'll see you next time.